Welcome to Anti-Aging Insights, where age is a state of mind and aging is a treatable condition. And now, here is your host, Dr. Teri Fisher.
Hey there, and welcome to episode number 100 of the Anti-Aging Insights podcast. Can you believe it? We are here at episode 100. And before I say anything else, I do need to take a moment and thank you for listening, for subscribing, for sharing the episodes, and for all the great feedback that I have received since I started this now a couple of years ago. So thank you so much for your participation. Thank you so much for being a listener, and it just really means the world to me. Today, we've got a special episode. It is an episode that we recorded when we were doing an Instagram Live recently, and we talked all about Sculptra. You can consider this essentially Sculptra 100, all the basics of Sculptra, things that you may want to know about when it comes to this special bioregenerative filler. And so rather than reinvent the wheel, I thought we would just share this Instagram Live with you. Now, I do apologize for the audio. The microphones aren't as great when we are doing the Instagram Lives, but nevertheless, it was great content and I wanted to share it with you, as I said. So without any further ado, let's get right to it. This is Dr. Get On Frame and myself talking about Sculptra.
Hello there, Dr. Teri Fisher, Dr. Get On Frame here at the Anti-Aging Medical Laser Clinic in Kitsilano, beautiful British Columbia. Sometimes sunny, not usually in the winter, but we love the air. So, today here at Anti-Aging, Dr. Fisher and I have been doing some training and education and upgrading on Sculptra, one of our favorite biostimulators.
Sculptra is PLLA, poly-L-lactic acid. It is a type of regenerative injectable implant that we can inject into various places in the body. And the beauty about this little magic powder is that it actually encourages the body to grow collagen and stimulate the growth of good, healthy skin and tissue. And it can make a huge difference in our appearance.
So it's not a filler.
It's not, well, it's a type of filler, but most people, when they think of filler, they're thinking of hyaluronic acid. Hyaluronic acid, and this is a great point. What are the differences between hyaluronic acid and something like this? Hyaluronic acid, you see immediate results. You inject it. It is a filler in the true sense of the word. You fill up the area that you're working on, and you see immediately.
That's the trap. That's the trap. Because filler, hyaluronic acid filler, looks so good most of the time, we are tempted to overtreat, overdo, overgo. And if you do it year after year after year in the same place, what happens? You get filler face. Now, good hyaluronic acid filler done by our team here at Anti-Aging Medical Laser Clinic, we don't do that. We try not to do that. But if you've accumulated filler, how long does hyaluronic acid last in your body?
Well, we'll say it lasts a year to, but we know from studies and from our own playing around with the ultrasound probe.
You did an ultrasound not long ago on one of our patients. And how long did she have the filler in there?
Years, 3 to 5 years.
Right.
So it does stick around. And as you put more and more in, you get what Dr. Fisher is talking about.
Exactly. So there is a movement. Some people want the immediate effect of the filler, and some people want the biostimulatory effect of Sculptra. They want to slowly, over 3 months, rejuvenate, grow collagen, thicken skin, smooth skin, get tissue underneath the skin to slowly and gently fill out. So let's have a look at what some Sculptra can do. So this is the Sculptra. The areas of the face that are on label for Sculptra are smile lines, marionette lines, other wrinkles. That's what Health Canada has approved. However, we've been doing Sculptra at this clinic for over 12, 13, I think it's coming up for 15 years. And we've learned and we've got experience with using Sculptra for face, for neck, for décolleté, for arms, for fat as well. And both Dr. Fisher and I have done numerous butt smoothing and filling out with Sculptra. But let's go back to the face. So if we look, it's a bit gruesome, pardon us, spoiler alert, if you have the cannulas, okay, but for safety's sake, what do we use over here?
So here we have a cannula. Cannula is very different than needle. If you're not familiar with a cannula is a device that has a blunt end. And that allows us to, once we have made a little hole for it, to actually slide it through the tissues. It's a much safer way because we're not going to be hitting and going into blood vessels. The blood vessels just kind of bounce out of the way of the cannula. And we can slide and we can fan the Sculptra in a larger area than you can with just needle.
So interestingly enough, if we look closely here, that Sculptra is actually an opaque liquid, but yet, blow it up. Yeah, look at that. That's a milky liquid. But hey, the Sculptra is a powder. So it's stable. It comes as a freeze-dried powder. It's got a long expiry time. It's stable on the shelf. We used to have to rehydrate it, put water in and rehydrate it months before, keep it on hand agitated. Now we've realized that we can rehydrate it, reconstitute it day of the treatment. You come in, you say, I want to smooth the skin on my face. I want to tighten skin. I want to fill gently in my temples, in my cheeks, in my marionette areas. No problem. We add sterile bacteriostatic water, a bit of lidocaine, so it becomes relatively painless. Mix it up. We've got all special techniques. We have a mixer, a mixologist. We have an assistant. We have all kinds. We're agitating it all the time. There's a special ritual to the Sculptra that we've learned is the best way to do it. And then, boom, with the cannula, it's fed around. You don't have to be particular about, I want this much here or this much there. You're doing a general field treatment. So this is great for people like me who don't particularly want a particular type of filler. I'm not fussed about my cheekbone here, my cheekbone there. I want general improvement. And I don't need it to happen today. I'm happy to have it over 3 months so nobody can see. Nobody would know that I've got, well, of course, I will not admit to, I cannot confirm nor deny that I have tried Sculptra myself a few times over the last 15 years. I cannot, but I do like Sculptra, just to say. And it does produce a beautiful smoothing and a slight filling of temples, of cheek area, and pulling and tightening back.
I think that's a great point because some people will come in and they want to have some type of treatment done, but they don't want it to be obvious. They don't want to have someone that they know look at them and say, oh, you just had something done. This is a way to do it because it happens gradually over time as the body grows the tissue. And so it's a very subtle treatment, but once that growth has occurred, you can have quite dramatic results.
So let's have a look. In about 3 to 4 months, this gentleman gone from like having, a fairly decent amount of lines, some pores and whatnot. Boom. He's got a smoother, clearer face.
Even the scar on his face too.
Yeah. Before, the fine lines. After, smoother, better texture, and better tone, catches the light better. The fine lines are improved. The pores are improved. The crepiness of the skin is improved. And when you stiffen and you create collagen, you get a bit of a gentle tightening. So nobody should be able to see. I dare you to tell me whether I have Sculptra in my face or not, and where I have Sculptra, assuming that I may or may not Sculptra. Just
once you have this treatment done, then there's a little bit of homework for this particular type treatment. You do have to massage it. We want to make sure that everything is distributed very evenly. So we've got the 5-5-5 rule. 5 minutes of massage, 5 times a day for 5 days when you get the treatment. And that's to help to ensure that it's distributed really evenly in the areas that we treat.
That's the only real complications that I've seen over the years is a little bit of a nodule, an overgrowth of the collagen in one particular area. And I've seen it twice out of many, many patients. And it settled over time. We managed to disguise it, to dissolve it, to get it to go down. And it wasn't a train smash. Sculptra is supposed to last 2 years. That's kind of the average time. It's rated for 2 years. My experience, I've seen it last a bit longer in some people. 3 years, for sure. This is a great niche biostimulator for people who come in and say, you know what, I keep getting filler and it just wears off quickly. It doesn't show. I'm applying money to my face. I'm keeping having to do 2, 3, 4 vials of hyaluronic acid filler. It's just going nowhere, but yet it's building up inside.
I have one question here. In comparison to someone who would need 1 or 2 syringe in their temples, how many vials would they need? Does it tend to cover more surface area compared to filler?
It's almost a 1-to-1 basis. If you need 2 vials of filler into your temples, 1, 2, you're probably going to need at least 2 vials of Sculptra. And the pricing is about the same.
Mm-hmm.
You can start with 1, half and half. You can go 2, you can go full 1, full 1. And you wait for it to grow at 3 months. If you're a good collagen grower, you're happy at 3 months. If you're not as good and you want to do more, you can do another 1-1. The recommended amount of Sculptra for full facial treatment is 1 vial per decade of age. So assuming I were to have Sculptra, or may have or may not have, being 63, I would need 6 vials. And you can choose. You can come see Dr. Fisher and you can do 1 or 2 vials today. And you can, in 1 to 3 months' time, you can do another 1 to 2 vials. And 1 to 3 months after that, another 1 to 2 vials. You can get up to your 6 vials. Or if you don't mind the 1 day of sweating, because it's water, it's mainly water taking this Sculptra powder in, the PLLA powder, you can do it all in one go. That's off-label, but many of our patients have tolerated doing 6 vials at once. It's easy to tolerate. You've got 1 day of sweating, you get over done with, you're over the sweating, and now you wait for it to go.
And I think we are seeing more of this, more in terms of people requesting this. There's a trend where people want to have more of the biostimulatory products, and it's a great one for that.
Yeah, I totally agree. Okay, any more questions? No giveaways today. Sorry, we can't give away Sculptra. This is a physician procedure, and we wouldn't want to be enticing you. You don't need any enticement. I'm sure that almost anybody of any age, and that's the beauty of Sculptra as well. You can use Sculptra up until you don't make collagen anymore. And for some people, that may be in their 70s, 80s, or 90s. But certainly, from a young age up to 80, you can probably benefit from Sculptra. Even younger people, this is becoming a trend. We have people walking in or phoning in, maybe diagnosing in, and say, my friend told me I need Sculptra. And we say, what for? I say, I don't know. I need it for looking better. How old are you? 32. Okay. Well, this is a 32-year-old, doesn't need filler, hardly needs botulinum toxin, maybe a bit of lasering, needs some skincare. They don't need filler, but they do want improved tightness and collagen, kind of de-aging or anti-aging of the skin. And that's where we see this as a biostimulatory, anti-aging injectable intervention.
If some patient and client asking about, is our brand is the top or the best brand in North America?
This is the number one, in fact, the only poly-L-lactic acid available in Canada. And it happens to be the brand name. So if you come from another country, you say, I have Sculptra. Maybe you didn't. Maybe you're a generic equivalent of Sculptra and I wanted it. But in Canada, at a licensed professional registered physician clinic, you will only get Sculptra. Certainly at our clinic. I can't speak for all my colleagues out there. At our clinic, you ask for Sculptra, you're getting brand name Sculptra. Because as you can see, we have it. And it is from Galderma, which is a company that makes also Restylane. And Restylane is one of the, I remember in 2003 when we launched our cosmetic service, the only filler we had was Restylane from Galderma. So they're one of the oldest, most founded companies in the injectable cosmetic business. And they are the ones that have now brought out, well not now, 15 years ago, have brought out Sculptra. And it is internationally probably the primary brand of poly-L-lactic acid. So yes, this is the Coca-Cola for Botox, the Hoover, and the Electrolux, and the Kleenex of poly-L-lactic acid biostimulators.
So fun fact, the other way you can get this is through threads. The type of threads that we do has PLLA in it as well, which has biostimulator.
Yeah, good point. I like that. Yeah. So that's a nice combination. And some of us may or may not have poly-L-lactic acid threads. And this is the thread. If you can see, this is the thread that we use at our clinic. And it's also made of poly-L-lactic acid. So the collagen stimulation of this thread, these threads are designed to tighten. They go well together. Both PLLAs, they smooth and they tighten, they create collagen. So you can inject it in or you can thread it in and it's going to last for 2 years. So that's a good point. Why our Instalift thread lift, Silhouette Instalift thread lift lasts 2 years and not 3 to 6 months of a non-Health Canada approved opposition thread available in other countries besides Canada.
There you go. So you can actually pick. You want it injected in the solution or as a thread? We have options here. Yeah, there you go.
And some people mix poly-L-lactic acid Sculptra, and yours is everyone smooth. and they use a little bit of filler, hyaluronic acid filler, to create defined lips. There's areas that Sculptra is not recommended. Lips, tear troughs. There's some areas. There's also some areas that if you want done, you should go to an expert. You should go to an experienced expert that's been doing this for a while and know how to handle it, because there are off-label and other ways to use Sculptra on the face to make it act more like a filler. But those ways need a higher level of expertise. All right.
There we are.
Okay, so we've now spoken today about Sculptra, polylactic acid, injected with a cannula, used for smoothing, sculpting. That's why it's called Sculptra. Filling gently, tightening gently, and improving the overall texture of the skin, of face, body, butt, and almost anywhere in the body that you can want to use it. And this Sculptra is available from Dr. Fisher, from myself, Dr. Friend, from Dr. Govinda Sami here at the Anti-Aging Medical Laser Clinic. We have a whole team available that will counsel you, will consult with you, will answer your questions, and will assist the 3 doctors here at Anti-Aging Medical Laser Clinic in Pietzalan, Vancouver, to help you decide if Sculptra is your way to go, and what's the best way to do Sculptra here at our clinic, and augment it and complement it with other injectables and other lasers.
Right. Great.
Thanks, everybody. Bye. See you next week.
See you next time.
Well, I hope you enjoyed that primer on Sculptra. We answered lots of questions, as you can see, talked a little bit about how it's done, what it's good for, who it's good for, where we use it, the whole bit. So if you are thinking about Sculptra, if you know somebody that's thinking about Sculptra, feel free to share this video, of course, or this podcast with those people. Thanks again for tuning in this week. As always, feel free to check out our resources on the web at antiagingvancouver.com, and we'll talk to you soon. Take care.
Thanks for listening to today's episode of Anti-Aging Insights. Stay tuned to discover more of the latest news, treatments, technologies, and developments in non-surgical cosmetic and anti-aging medicine. For more inspiration, to access the show notes, or to book an appointment with Dr. Fisher, Dr. Frame, or any of the other anti-aging professionals, please visit our website at antiagingvancouver.com. Until next time, stay inspired and live life well.